Bismillahirrahmanirrahim. Assalamualaikum and salam sejahtera to all. First of all, I would like to thank the organizing committee for such a precious opportunity for me to talk about something which is extremely important to all of us. World Health Organization already declared 17 September as World Patient Safety Day, which will be celebrated all over the world every year. So the theme for 2022 this year is medication safety with slogan medication without harm. So this webinar is, as mentioned earlier, proudly organized by Medical Care Quality Branch, Medical Development Division, collaborated with Pharmaceutical Services Program, Ministry of Health. Okay, so the content of this presentation is the first one we are going through some introduction why medication safety is important. Then the second one is we'll go through some of the medication safety governance. Then next we are going to medication safety activities and achievements, learning and sharing from medication error reports, as well as how to encourage ways to improve the safety of medication use. So now let's get the ball rolling with introduction for us to get to know why medication safety is important. Okay, numbers do matter. Why? Because one in 5 medication doses administered in hospitals is given in error, and at least one death occurs per day, and 1.3 million people are injured each year due to medication error. This is the data that we get from US Food and Drug Administration 2009. Medication safety also has impact on multiple parties. For an example, as for patient, the impact on patient will be it can change or may change patient's health status. It can help to prevent overdose of medication for the patient, because we know that medication error is it can be from no harm to patient until patient's death. Okay, as for financial implication, it can also prolong hospital stays and increase healthcare expenses, estimated to cost billions of dollars annually, additional medical management, as well as legal fees and out-of-court settlements. Okay, so sharing here is among most of you commonly used terminology in medication error, which will be, the first one is adverse drug reaction, or ADR, which can be defined as a response to a drug that is noxious and unintended that occurs at doses used in humans for prophylaxis, diagnosis or therapy of diseases, or for the modification of psychological, physiological function. The second one is adverse drug event, or ADE, which is an injury resulting from medical interventions related to a drug, and this includes both adverse drug reactions in which no error occurred and harm resulting from medication error. And as for medication error, can be defined as any preventable event, or the keyword here is preventable event, that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, carer, or consumer. And medication related harm is actually patient harm related to medication that includes preventable adverse drug events due to medication, maybe due to medication error, and non-preventable adverse drug events such as an adverse drug reaction. Okay, this slide actually look a little bit complex, but let's go through this slide together. The diagram is actually showing the relationship between adverse drug events, potential ADEs, and medication error. Okay, when harm occurred, either it can be preventable from happening, or if the harm already occurred, is there any way the incident can be minimized? So the examples of preventable incidents include medication prescribed for a patient who had documented or known drug allergy to that medication. The second example is an overdose medication prescribed, dispensed, or administered to patients. And the last example of preventable incidents will be medication prescribed correctly, but administered by wrong administration route or administered wrongly. Okay, next, the example of medication incidents where the harm could have been minimized usually involve an error in the medication monitoring process. It involves the whole process, or one part, or it can be also one part of the process. For example, failure to monitor and adjust the dosage of high-risk medications such as warfarin, lithium, anticonvulsants, glycopeptide, or aminoglycosides antibiotics, and failure to monitor full blood count and assess renal clearance in patients on non-steroidal anti-inflammatory medications, and where necessary adjust treatment and co-prescribe other medications such as gastroprotective agents. And the last example, the failure to monitor blood sodium and potassium level, adjust the dose of diuretics, and when necessary, co-prescribe with other medication. So this is the examples of preventable incidents as well as the examples where the harm could have been minimized. Okay, so it is important to note that slogan medication without harm is not a new thing, since it has been promoted as medication safety challenge, as a medication safety third challenge in the year of 2017. Okay, so what would be the strategies recommended to achieve medication without harm? Number one, to target patient and public, of course, promotion towards quality use of medicine is utmost important to increase good health literacy. And as for number two, since medication being the focus in this issue, for example, identifying high-risk medication and polypharmacy which can lead to medication error is crucial in helping prevention of error. And as for healthcare professionals who are the main player, education and training to ensure competency cannot be taken lightly, and continuous education plays an important role in achieving this. Lastly, we also need a good and structured system and practice such as standard operating procedure or SOP, the policies, the guidelines, compilation and analyzing data information with regards to medication error, as well as a good model of transition of care. Okay, for example, this is some of the promotional and educational materials for patient safety, national and internationally. So this is the promotional and educational material from WHO. Speak up for patient safety, and no one should be harmed in healthcare. This one is also World Patient Safety Day educational material in 2021. And this is our national safe health workers, safe patients theme for World Patient Safety Day in 2020. And as for last year, World Patient Safety Day last year, our theme was safe maternal and newborn care. So this is the activities or the webinar that we had also on 17th September last year, 2021. Okay, so let's go towards our second content or objective, which is bits and pieces of medication safety governance. Okay, we have actually a few levels of governance or council. We have Medication Patient Safety Council at the level of MOH, as well as Medication Safety Goals or MPSG Steering Committee to ensure patient safety. And state and health facilities also have their own patient safety committee as well as patient safety committees, and MOH also, and this is the medication safety activities also being done at the state level, facility level, as well as at the national level. And for example, we have technical working group to ensure medication safety, and for each technical working group we have TWG for prescribing committees, TWG for dispensing committee, and TWG for administration committee, so that for each and every committee can help look further into the issues with regards to medication safety in prescribing, dispensing, as well as administration. So this is the terms of reference for medication safety goals or MPSG. The terms of the objective of MPSG will be to strengthen the implementation of MPSG at various levels, to closely monitor the performance of MPSG, to plan strategies as well as facilitate remedial actions for specific MPSG to improve performance of medication safety, to effectively and efficiently promote and disseminate information on MPSG or medication patient safety goal, to give input and feedback related to implementation of specific MPSG and related issues, to plan the way forward of MPSG in more comprehensive and holistic manner, and last but not least, we hope to make recommendations regarding amendments to specific goal, indicator and target to prevent or to safeguard our medication safety in the country. Okay, so next, for MPSG, the first version of MPSG, we have 13 goals, but the latest version of of MPFG, we have 7 goals. And goal number 3, medication safety, medication without harm. And number of medication error related to severe harm or death. The target is 0 cases in all clinics and hospitals all over the country. And we also have additional data collection on total number of medication error, the total number of near misses medication error, and the total number of admission and or clinic visit. Okay, and goal number 6 in MPSG, MPSG 2.0 is correct patient identification, because patient identification is very important, because the number of incidents caused by wrong patient identification detected by incident investigation should be 0 cases, because if we can't identify patient correctly, so we might give the wrong medication to the wrong patient. Okay, so the next objective or the content of this presentation is medication safety activities and achievements. Okay, so a little bit of recap. What is medication error? We mentioned earlier that any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of health professional or patient or consumer. So such event may be related to professional practice, healthcare products, procedures and systems, including prescribing, audio communications, product labeling, packaging, nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and the use of medication. Okay, this is a recap. So we have actually many steps in medication use process. So the error can happen in any of the steps. It can be from diagnosis of patients, prescribing, dispensing, administering, monitoring, as well as the outcome. And then we get the outcome of the patient or the outcome of the error, whether the error happened or not. So the prescribing, in the prescribing, what we need to do is basically we need, of course, to evaluate the patient, establish need for medications, select the right medication for the right patient, determine interactions as well as allergies, and then prescribe medication. When the medication prescribed, then at the dispensing process, the prescriptions order need to be reviewed. Then if there's any discrepancy, prescribers need to be contacted to ensure that all the medications are correct. And then at the dispensing level, we have to prepare the medication and then distribute or dispense or supply the medication. And then we go to the administration. Administration also, if the patient is in the ward, the staff nurses or the doctors, we need to review the prescription order. We need to also review what would be the warnings, the interactions, as well as allergies, ensure 5R, right patient, right dose, right time, and so and then administer the medication. And in terms of monitoring, as we mentioned earlier, monitoring also is very important. We need to assess patients' response to the medication, and also because if there's any issues with regards to medication use, need to be reported and documented. All the results need to be reported and documented. So the errors actually can happen either at prescribing, dispensing, administration, as well as the monitoring. Okay, so what would be the errors in the medication cycle? As mentioned earlier, what the errors in prescribing, it can be wrong dose, wrong drug, wrong route or form, wrong allergy, dispense or prescribed to the patient with documented allergy, as well as failure to see the to see the drug interaction, to foresee the drug interaction with all the medications prescribed. And for hospital with a system, or we can have entry in the wrong the mistakes in data entry. We can enter the wrong dose, wrong drug, wrong route, wrong time, or as well as wrong patient. So at the dispensing error, at the dispensing level, it can be wrong dose as well, wrong drug, wrong route, wrong time, wrong patient, and incorrect labeling. And for administration, it can be as well as the same, wrong dose, wrong drug, wrong route, wrong time, or omitted doses of medications, wrong patient, and incorrect labeling. So this is sorts of many sorts of errors that can happen in the medication cycle. So reason proposed, what is preferred to as the Swiss cheese model of system failure. Every step in process has the potential for failures to varying degrees. The ideal system is analogous to a stack of slices of Swiss cheese. So consider the holes to be opportunities for processes to fail, and each of the slice as defensive layer in the process. An error may allow a problem pass through a hole in one layer, but in the next layer the holes are in different place, and the problem should be caught. Each layer is actually a defense, an important defense against potential error impacting the outcome. So this is the analogy that is commonly used for medication error, how medication error can happen, which is the Swiss model. Okay, the types of medication errors as mentioned earlier, just a bit of recap: prescribing error, omission error, wrong time error, unauthorized drug error, the dose error, dosage form error. It can such as the patient might need the oral form, but we give injectables despite of the oral form. Drug preparation error, route of administration, intramuscular be given intravenous, administration of technique error, deteriorated drug error, monitoring error, compliance error, and other medication error as well. Okay, now what would be the medication safety activities and achievements that we have been doing so far? So for this, we actually have reporting and learning. We have policies and policy and guidelines development, as well as education training and information dissemination. Okay, for the importance of reporting and learning is to strengthen medication error reporting system, and for us to and managing a database of medication error reports received from healthcare facilities nationwide, because it's very important to have the data for medication error, because the data can be used to have improvement in the system. Okay, what is MERS? MERS is Medication Error Reporting System. So the objective of MERS to obtain information on the occurrence of medication error. Next, when we obtain the information, we have to analyze the medication error report, and then what we do with the data that we analyze. We have to learn, and we have to share, so that the mistakes can be learned and share experience of ME or medication error, so that we hope with all the data and learning experience or learning sessions, we can help to minimize the reoccurrence of such errors, and last but not least, of course, to improve patient safety. So the outcome analysis from medication error reporting system is what would be with medication error related harm, the percentage or the occurrence of near misses, what is the actual error. We can also have the case review from outcome analysis, drug related problem such as polypharmacy, and also recommendation of key priorities area in how can we improve the medication error reporting system. And this is what we have currently, medication error reporting system. We have it online, or healthcare professionals either in government and private sector can can use the system to report the error. Okay, we have a guideline on medication error reporting system, or MERS. What is the definition for near misses? So in this guideline, we report all the near misses as well as actual error. So the near misses defined by error that has the potential to cause an adverse event or patient harm, but did not reach the patient because the chance, or because it is intercepted in the medication use process. We see the error, we do the intervention, and actually we stop the error from reach the patient, but the actual error, medication error that occurred and reached the patient. Okay, this is the MERS journey, some of the our long and winding journey of medication error reporting system. It was launched in 2009 and manually, and then 2011 development of medication error reporting system online, and then 2013 this is most online that we have. 2017 we have also improvised some of the processes involved by appointment of state verifier, verification by state verifier, verifier, as well as migration of MERS server. And the changes in MERS is that we can shorten workflow from 3 steps to 2 steps for near misses for category A and B, and the Q report function added to the GKN viewer, which the state can also review the data that submitted to us at the ministry level. Okay, this is the examples of the data that we get from our MERS. This is the example of total number of medication errors reported from 2009 to 2022 until to 2021. We can see that from 2009, when we do our manual reporting, the total number of medication error that was reported only 2572, and now until 2021, the cumulative medication error that we have from 2009 is 311,416, and for 2021, the total number of medication error reported was 59,672, as compared to when we first initiated our reporting manually, it was only about 2,572. Okay, this is the percentage of actual error and near misses from 2009 to 2021. Okay, we can see that the near misses is actually it is a bit plateau now, and then because majority of the, we can see that, but majority of the error that being reported into the medication error reporting system was actually near misses, and this is the error that breached the patient. We can see that, for example, in 2021, 97.5% errors reported were actually near misses, meaning this percentage of error did not reach the patient, and only 2.5% of error reached patient. Okay, we also have policy and guidelines that we develop. The functionality of policy and guideline development is to plan strategies, initiatives to help us to prioritize action and develop policy for system improvement, to encourage, of course, safe medication uses. And one of the few things that we do is the policy implementation in our in our pharmacy information system, which PHIS. PHIS is a complete and comprehensive system that integrates pharmacy-related services with the objective to gear toward pharmacy excellent care. It's also meant to enhance patient safety measures by increasing access to patient medication records, improve the pharmacy workflow, and substantially reduce the risk of medication error. The decision support system in PHIS that we have currently, which is MIMS Getaway, helps to improve the quality of checking along the medication management process. And also medication safety self-assessment of MSSA criteria checklist for medication safety evaluation has been established to guide the healthcare facilities on the improvement of medication safety practices. Okay, and the journey actually continues to have to guide us to help reduce the number of medication error, which we also develop. We also develop the key performance indicator with regards to medication safety. And this is the KPI that we have previously for the Director of Pharmacy Practice and Development Division, whereby all MOH or Ministry of Health facilities must achieve full compliance of more than 80% in medication safety self-assessment criteria. Also, this is what we have, meaning from we have increase of the increasing trend of MSSA achievement with 92.9% towards 98.9%, 98.4%. Okay, there are various of medication safety guidelines that been developed from the Ministry of Health. Okay, we have dilution guideline for injectable drugs. We also have guidelines on medication error reporting system, as mentioned earlier. Guide to good dispensing practice, pengesanan pesakit dengan alahan ubat or drug allergy, guideline on the safe use of high alert medication or HAM. Guidelines on handling look-alike, sound-alike medications, syringe labeling in critical care, and also quick guide in preventing prescriptions error. So this all the medication practices guideline were meant, of course, to reduce to promote medication safety, of course, for us to get medication without harm. As for education, training and information diffusion, strengthening and monitoring medication safety activities through briefings, talks, trainings, campaigns, exhibitions and publications, radio talks and others. Okay, the medication, we have lots of medication safety activities in 2000. This is the examples of the number of medication safety activities from 2016 to 2021. And in terms of education, training and information informations, we have newsletters, medication safety alerts, training modules, as well as the last is actually the education videos for medication safety. Okay, this is some of the examples. This is the videos, the examples of the scenes in the videos. Medication safety is everyone's responsibility. So this is for us to promote 5 detik penting for pengambilan ubat yang selamat. Okay, and also this is the educational materials. Tanggungjawab anda sebagai pesakit, sila maklumkan nama penuh, alahan ubat jika ada. And then before you give it, know your medication. Check you have the right patient meds, the right medicine, right route, right dose, and right time. And ask if your patient, whether your patient understand or not. And for the patient, before you take it, know your medication. Check the dose and time, as well as ask your healthcare professional. So this is patient's responsibility. This is healthcare provider responsibility, and this is patient's responsibility. And if any errors happen, this is the importance, or this is how you can report this is how we can report the errors through MERS online. And this is also bits and pieces on why reporting medication error is important, why to report, who can report, and how to report. It's all in educational materials that being prepared. Okay, this is also being placed at the pharmacy counter. 3 langkah bijak semasa mengambil ubat, dan juga 3 langkah bijak sebelum memberi ubat kepada pesakit. So it's all about kenali, semak and tanya. For the pharmacists who are going to dispense the medication, they have also kenali, semak and tanya the patient. For the patient also, we have to know what types of the medications you are taking. We have to also semak nama ubat adalah untuk pesakit yang betul, dos, cara pengambilan dan juga masa pengambilan. And if there's any questions or queries, please do ask the pharmacist at the. Okay, this is also the materials that has been developed and disseminated to increase health literacy in medication error. And again, this is some of the materials that being developed for us to remind, for us to remind our healthcare provider, for us to remind our patients, for us to remind every one of us the importance of medication error, the importance of to do it right, write it right, and the importance of listen carefully when you receive the medication, and get to know your medication before you give it, or get to know the medication before you receive the medication. Okay, this is again some of the examples and the materials that has been disseminated. Okay, always check the expiry date before use. It's very important to ensure that the patient is not using the expired drugs, and the pharmacy also shouldn't prescribe, shouldn't dispense or supply expired drugs. So it's everybody's responsibility, because using expired drugs or expired medication is also considered as medication error. Okay, this is the activities and educational activities that we do. I hope many of us, many of the viewers today have encountered this kind of activities. We do have this kind of activities at the hospitals, at the community, as well as at the health facilities. Okay, this is all the activities and the trainings, our training to our healthcare provider. Okay, so now we go to the objective of the second last objective of the presentation, which learning and sharing from medication error reports. Okay, so when we have medication error, so sharing the errors is extremely important. For example, we have here accidental injection of potassium chloride instead of dextrose 50%. Okay, what's the purpose of sharing? The purpose of sharing is that the error happening at one particular center, maybe. So the purpose of sharing for us to share for us to share and prevent, hoping to prevent the error not to be happen again at the same facility or at the other facility. So this is the second error that we share. Medication administration error, risk to patient safety. This is the examples of MAEs, and this is the safety reminder on the use of chloral hydrate. Why? Because we have errors with chloral hydrate. So this is actually can be a reminder, can be a learning experience, as well as prevention measures for us to prevent the same error from happening. Okay, again, we have newsletter, sharing newsletter on benzathine penicillin or benzyl penicillin, preventing harm through safe use, and also identifying the right patient is a vital step to check and recheck the data that you need to enter. This is extremely important for hospital or facilities with system or computer system, because rubbish in will be rubbish out. And this is the sharing on the medication safety alert on warfarin, on heparin, the risk of dosage errors in warfarin, in heparin. So the last for this today's presentation is the strategies to improve the safety of medication use. Okay, there are actually 10 strategies to minimize medication error. The first one is to ensure correct entry of the prescriptions. If we are using the system, confirm that the prescription is correct and complete. Be aware of look-alike, sound-alike drugs. Be careful with zeros and abbreviations. Organize the workplace, because if the workplace is miserable, then it can also be one of the contributing factor for errors. Reduce distractions when possible. Talking over the phones, I can also be some kind of distractions and can lead to error. Focus on reducing stress and balancing heavy workloads. If you have been in the counter for more than 3 to 4 hours, so maybe it's high time for you to shift, to go back at behind of the counter, and somebody else to go in front of the counter, and take the time to store drugs properly, arrange the drug properly, thoroughly check all prescriptions, and always provide thorough patient counseling. So this is what we have here is 10 strategies to minimize medication error, but the strategies to minimize medication error actually is not limited to these 10 strategies only. Anything that help us to minimize medication error need to be done to prevent medication error from happening. For example, decimal point and zeros. Medication error, okay, it is using a leading zero before a decimal to reduce the possibility of misreading the dose as a whole number. 0.5 mg as compared to 0.5 mg, because sometimes when we are in a hurry, we might not see the decimal. You see, so it can be wrongly administered or given as 5 mg, although it's actually meant for 0.5 mg. And the second one is do not place a decimal point and a zero after a whole number. This trailing zero may cause the decimal point to be overlooked and result in tenfold dosage error. 3.0 ml, it can be actually meant for 3 ml. So if you can't really see the decimal, then it can be 30. But by right, the dose should be 3 ml, so it's going to be tenfold. Okay, so read the label. This is what we call triangle check, prescription request form, medications and medication labels. So when we have the medications envelope, we see the prescriptions, we check with the what is the medication is in the envelope, what is the label on the envelope. This is what we call triangle check. Okay, the sources of error is actually we have so many sources of errors for medication error to happen. So it can be mixed up patients, such as mentioned earlier, distractions and interruptions during drug administrations, mix up of drugs, such as lack of light on a night shift can also be contributed to error. Similar drug names and packaging. It can also it can be due to mistakes in calculation of drug concentrations, incorrect of missing and labeling solutions, wrong or omitted past the expiry date, use of inappropriate diluents, incorrect transcriptions, contaminations of solutions, wrong storage. It can also be insufficient mixing of ingredients and incompatibilities of the medications, and the list continues. Okay, so there are sorts of many sources of errors that contribute to medication error. So normally what we do is we look when we do the RCA or root cause analysis. The fishbone diagram is also sometimes helpful, because all the sources we can separate out into patient factors, individual or staff factors, task factors, communication factors, team and social factors, organizational and strategic factors, working condition factors, equipment and resources factors, and education and training factors. So we can identify the problem or issue in care delivery or service delivery problem, and we can also prioritize what would be identify what would be the most the highest weightage of contributing types of errors. Okay, so what is your role or our role as healthcare professional? Of course, we think using generic names is much better than brand names, but not with biosimilar, please. Okay, tailor prescribing for individual patients. Take complete medication histories. Caution on a high alert medication or LASA, look alike or sound alike medication. Communicate clearly. Remember 7R, 5R, 7R, or 10R. Use memory aids. For certain patients, be familiar with the medications. Practice double checking or counter checking. Encourage patients to be actively involved, and report and learn from errors. Okay, so the issues and challenges for medication error reporting or medication error is complexity of medication management process. Medication process is not just one single process, so it's a very complex process. And also the next is going to be harmonization of medication error reporting involving various stakeholders. Currently, we have mandatory as well as voluntary medication error reporting. We hope that all medication error in this country can be mandatorily reported. It's also it's very challenging to understand the system, the causal and effect contributing the factors. It's also issues to barriers to error reporting. It's very hard, but we need to encourage and work to have a good patient safety culture, and we need to have, of course, effective communication in patient care. All of us have to really communicate well towards patient. Okay, so this is the conclusion of my presentation today. Reporting and analyzing medication error data provides a better understanding of the root cause of the errors, and to identify the weakness in the system for system improvement. Medication error reporting system provides useful data and enables facilities to proactively implement safer system and reactively improvise their system, especially in those identified in critical areas. And learning from previous errors may reduce medication-related harm and recurrence of errors. So with that, I thank you for your kind attention, and please don't forget that shared responsibilities, everyone played their own role, and encourage safety culture. Medication safety starts with you, with all of us. So thank you so much.